name is Melissa Cacamo, and I'll be your host for this evening's event. We made the decision to hold this event because of the amount of questions that we were getting in our clinic. We hope this event is helpful for you, and we ask that you drop your name and email in the chat box so that we can keep you up to date on future events like this one. If you have questions along the way, please also drop those in the chat box. We've assembled a panelist of clinical professionals who've been working on the front lines since the beginning of the pandemic. Every day they field questions from patients, families, and team members, and they work tirelessly to ensure the safety and well-being during this time. Their experiences have helped us to shape the day-to-day that we are now calling the new normal. I'm pleased to welcome our panelists, Dr. John Alexander. Dr. Alexander is our Chief Medical Officer at Central Maine Healthcare, and he's the Medical Director for Maine Urgent Care. Dr. Dave Salko, he's the Regional Chief of Primary Care. He works at Thompson Family Medicine. Jamie McMaster, our Operations Manager at Maine Urgent Care. And Deb Kiker, the Director of Occupational Health and Wellness for Central Maine Healthcare. We're going to start the evening listening to Dr. Alexander as he talks with us a little bit about his experiences working on the front lines of the pandemic and how he's worked with our patients and teams to ensure the best possible care during this time. Dr. Alexander.
Thanks, Melissa. And thank you to everyone who's joined this evening and who'll be watching this afterwards. It's really been a pleasure to work with such a wonderful and dedicated group of professionals at Central Maine Healthcare and here at Maine Urgent Care as well. And I know that there are a lot of questions that are out there as we've been facing many of those every single day, both our clinicians, our team members throughout the organization. When we started this journey really back in February, we decided that the most important aspect of preparing for this pandemic was the safety of our employees and the safety of our patients. And along the way, we've taken steps to make sure that that remains our first priority. Currently in the state of Maine, we have one of the lowest rates of transmission of COVID in the entire country. We do have 3 counties in the state that stand out somewhat against the other counties, namely York, Cumberland, and Androscoggin County. And we continue to observe on a day-by-day and on a week-by-week basis both the testing numbers, the positivity numbers, and any other trends that are important in terms of how businesses, how schools, how our own patients, and how our own clinics function. One of the big challenges that we've had more recently has been some of the rising cases in other parts of the United States, and of course those who would want to travel up to Maine to enjoy some of our seacoast and some of our mountains. So we've been especially vigilant in terms of making sure we have testing available to them. And we've also been trying to provide as best as we can guidance and advice around some of the important public health requirements such as masking, hand hygiene, and social distancing. At our facilities at Central Maine Healthcare, we've taken those into consideration as well as several others. We've made sure that all of our offices, our primary care practices, our procedural areas, and our hospitals have taken all of the infection prevention precautions that they can. We ensure that every room is cleaned after patients use them. We ensure that all of our team members and our providers are following the proper PPE guidelines. And in our facilities, we also offer testing to any patient who's going to be admitted or who may be coming in for a procedure. In addition to that, we've made sure that we have community resources available at several of our facilities, including both the Thompson and Lewiston Maine Urgent Care sites, all of our emergency departments at Bridgeton Hospital, Rumford Hospital, and Central Maine Medical Center, and several primary care practices throughout the region. The question that's come up more often than not has been, how do I know it's safe to come in to see the doctor, and how do I know it's safe to come into the hospital? And we made sure by putting all those precautions into place that your health needs and your safety is of the paramount importance. And so I'm going to turn this over to Dr. David Salko, who will tell you a little bit about his experiences in primary care and some of the questions that he has been facing with patients who come to see him.
Thanks, Dr. Alexander. Everybody. It's always fun to kind of do one of these things. We have our room separated and set out. We hope that everybody's able to hear us. If you can't, please send a little chat message in there if you're having any difficulty. And as you have questions, Melissa Catmull was able to type those in. We're happy to answer them. I work over at Thompson Family Medicine, which is pretty close to this the Thompson Care Center here. We see all comers, kids, babies, newborns, all the way on up to geriatric patients. And yeah, this has been definitely a different time. The words new normal, unprecedented, all these things come up as buzzwords a lot, but there's definitely a transition here in what we experience, not just in offices and hospitals, but in our homes, in our school environments, in going to the grocery store. It has changed a lot of how we just walk through life. Our social engagements, our interactions, going out to restaurants. So this has touched everybody in some way, shape, or form. So we want to make sure that people have up-to-date and current information. We want to make sure that people are doing the best to keep themselves, their families, and their friends, and the community safe. So there's lots of questions that we get asked on a regular basis, and we try to go through the CDC guidance, the Maine state guidance, and try and give people good advice that they can so that they can maintain proper health and safety during the pandemic. In terms of questions that we get asked a lot, there's things that people ask frequently, and I try to frame the answers based on what we have the ability to control or not control. People may ask questions about the vaccine, and that may be something that's out there in the press, but it's something we're going to have to wait for, okay? Asking questions about testing is something that we can facilitate now. There's testing available at the Thompson Care Center, at Thompson Family Medicine. We also have testing available. So that's something we want to make people aware of. Things that individuals can do to help themselves through this. We certainly know the general precautions of hand washing. Very important. There's been many studies on hand washing. We know we're going to reduce the spread if we wash our hands more frequently. Wearing a mask, okay, a big piece of it. My mask that I'm wearing now is protecting the other people in this room. I'm not going to spread any respiratory droplet from myself because it's being blocked by this mask. And then social distancing. If you're outside maintaining or even inside maintaining a distance of 6 feet, will prevent the spread. Anybody can go to the CDC's websites and see these general guidelines. They're helpful, they're routine, they're things that are out there that we know we can do to help protect each other. Other things that are important for our general health, certainly the hygiene that I mentioned with washing hands, making sure you're getting the right nutrition, okay, making sure that you're getting enough sleep. These are just essential things that if you should ever get sick, these are things that can help you maintain your health and get through these challenging times. If for other reference things, I think this has had a huge impact on everyone's mental health. Like I said earlier, this isn't something that's going to go, that anybody's going to go untouched with. Not that you'll get COVID, but I challenge people sometimes in the office to have a conversation and not have it involve COVID somehow. And that may be one of the mental health cues that I give people to try to do. But feeling depressed, feeling upset, feeling anxious about this kind of situation is normal, okay? It's a natural response that we have to protect ourselves. So we would want to help people by being able to talk about it, talk with their friends about it, but also make sure you're attending to your mental health, that you have some things that you can cope with, things that you enjoy doing. And all those challenges, all those things that we used to love and do, like going out to a restaurant or enjoying time with friends or family that might visit from out of town. We still want people to be able to do those, but do them safely, okay? If you're going to entertain family from out of state, there are places that those family members can get tested. And it is awkward to try to treat family like as if they're a stranger, but knowing if they're a carrier or not, you're not going to know that. So the mask helps. They wear the mask, you wear the mask, and you get to spend some social time with them, okay? It's important for us to challenge ourselves to get through each of these social situations so that we can continue to experience the community sense and improve and support our mental health as we go through this. The only thing I will also guarantee people is it's not going to stay the same. It's going to change. And this fluid situation can also make people feel anxious. I think everybody here would agree we've come a long way since February in what we know and understand. And now making places safe, like Dr. Alexander mentioned, being able to come to the doctor's office, go to the hospital, have an important procedure done that's necessary for your health is now made much safer by the protocols that we've put in place. Okay, so I still have patients on a regular basis that I worry about because I fear that they might restrict their health care or their access to it based on a fear that they may get COVID. Okay, so early on in the course, in February and March, when we didn't know, when we didn't have enough testing to be able to identify it, that was a legitimate concern. Now, with testing and tracking in place, enough testing, with protocols at the hospitals and at the regular outpatient care facilities, you should feel a lot safer because we know we're doing all the right things to keep people safe. And I encourage people to come out or even call our offices if they want to be able to do that. Other places that you can definitely access urgent care if needed over at the Thompson Care Center. There's testing there, okay, and they have protocols and procedures in place there as well. So if it's a timely need that you can come to the office and make an appointment, if it's a surgery need, if it's an urgent care need, the medical system and the medical environment has put a lot of protocols in place to keep people safe. My fear is that people will stay home and perhaps get worse or sicker rather than access care. So we want to make sure that message clear is that reach out to us. We're here. I guess I can introduce Jamie. She's over in charge at the Thompson Urgent Care and over at the Thompson Care Center can explain a little bit about what they have for access and ability there in terms of testing and things that people can access.
Thank you, Dr. Thompson. So a lot of kind of what he went on initially is that we still want patients to get the care that they need. So we can offer some of that care at urgent care. We are open 7 days a week, 8 to 8. So if it's in the evening and you can't get to your primary care, it could be something as simple as a rash, but it's something that you need taken care of. We don't want people to prevent getting that care. We do have options for our patients. They can come into the office. They don't need an appointment, or they can reserve appointments. But they can also do a virtual visit if they don't feel comfortable leaving their home quite yet, or they have other comorbidities that make them higher risk. They can do a virtual visit. Things like rashes, insect bites, like a conjunctivitis. Those are great examples that can be done over a virtual visit. And then if the provider feels you need further care, they'll let you know that, and there's an option to come in at always, anytime. What we're getting right now is people are nervous because they're not sure what's COVID, what's an allergy, what's a cold symptom. So what we've done at urgent care is that if someone's asking for a COVID swab, you can definitely come in and get a COVID swab. You'll see a provider. The provider will get your medical history, your current medications. They're also going to do an assessment. They're going to see, do you need a COVID test, or is there more? Do you also need a strep test or a chest x-ray? So you're getting a full assessment from a provider, and then also a discharge plan to let you know what to do. There's so much information out there. It's hard to know what's most up to date. Should I quarantine? Does my family need to be tested? That's where you're getting all that information, that knowledge within your discharge plan from the provider. So it gives you peace of mind that you know you're doing the right thing, you're keeping everyone safe. As far as urgent care, we have gone some extra steps above with keeping our cleanliness. We've had extra services with our cleaning within the facility. We do it 6 feet apart. We also changed our waiting room around. Patients also have the option to wait in their car, and we can call them to come in. So if they feel safer outside, it's perfectly acceptable regardless of what they're there for. So we want patients to know that we are still there for all of our regular services, not COVID specifically, but anything, even a sports physical. As we look at women at schools and sports, a lot of them still need some pre-exams, so we can still do common things like that. But we want people to feel safe and know that it is okay to come get those services. As we come into the fall, we're looking at flu shots. We will offer those as well. So there is always options, and we're still offering the same thing. but as well as giving you the resource for COVID testing. We also test people who aren't symptomatic. So if you've traveled, if your school is requiring it, if your job is requiring it, we can also do the COVID test the same way for you. We work really closely with our urgent care accreditation. They are accredited across the U.S., so we work closely with them as getting some guidance. What have they run into in different states? What have they done for protocols? What's worked and what hasn't? So we've really been able to adapt from those states that have higher risk in how can we get ahead of it on our side, and what works for them, how do we adapt to that? And that's been really helpful for our everyday testing, everyday care of patients. We are getting multiple questions on COVID, so we are happy to answer the patient's call. We do testing at both locations, at our Lewiston location and our Thompson location. The provider will see the patient attend, and we can get those out fairly quickly and try and again see what other services that the patient may need at that time, and take care of all those. Kind of back to, again, just not preventing the care, and if you have questions, if you're concerned, if you're not sure what it is that you may be experiencing, to definitely feel free to use us. Come in, call, try a virtual visit. We're definitely there for whatever care you still need. So some of that comes back to the employers, what employers are asking for. I'll turn that over to Deb. She can give you a little more information on that.
Thanks, Jamie. And as we saw early on, businesses closed, people stayed home, they either worked virtually or businesses closed altogether. But around the end of March or the 1st of April, people began to come back to work. And we received calls from businesses saying, how do I come back to work? How do we make sure that our team members come and they're safe and they know that we've done everything we can? It was a great opportunity for us to partner with a variety of businesses, everything from small law offices to small nonprofits to a large manufacturing group. And we met those folks on an individual basis, walked through their companies, walked through their production lines, walked through their meeting rooms, walked through their entryways, and just took a from the front door to the back door kind of approach to how do we make sure people come safely. We introduced screening protocols that we've used in the hospital successfully from the beginning. We talked about temperatures. We talked about protocols to reduce traffic in hallways, reduce the number of people in the office at a time, maintaining still a somewhat remote workforce and having people come in at different times. And we've stayed in touch with those businesses that we consulted with throughout the spring and into the early summer to make sure that their people have come back and have maintained a safe environment. We touch base with them about once a month, and everybody that we've consulted with has brought staff back, some more slowly than others, some more in a more robust fashion than others. We had a couple that, after they came back, had an exposure and very quickly had a plan in place, like you'll hear Dr. Selko say, have your plan, and very quickly worked their plan and were able to maintain the safety of their office and keep people working. One of the things that businesses often ask as we talk with them is, how do people seek care? And you heard Jamie say that making sure people have access to care is important. Many businesses realize that their people, their staff, their team members don't all have a provider. So urgent care becomes that provider of choice. And with that, there may be ongoing needs. Maybe in an urgent care visit, you find there's another need, another health issue. And the nice thing about teaming with urgent care and having urgent care be part of our larger CMMC group is we have access to get you into regular care, to find a provider, to find a pediatrician. Perhaps you're working and you remember that I went to urgent care for a pre-employment physical, and now my little boy has a temperature and I come down here and he has strep and I'm well taken care of, but that reminds me that I don't have regular care. So we can get you situated with providers with all the things you need to take care of your health, not just in an urgent manner, but so that you have well-rounded health care.
Thank you, Deb. We've had a number of questions that were submitted ahead of time, and we're going to start with those. Just as a reminder, if anyone has questions, if they want to submit those in the chat box, you can go go ahead and do that. So one of the common themes that we heard from folks is around masks. So the question is, why do we wear masks? So Dr. Alexander, would you be able to tell us a little bit more about why we want to wear a mask and why that's so important?
Sure, and thanks, Melissa. And I think Dr. Salko covered that pretty nicely when he talked about the fact that the mask is here really to protect others from us. We have different types of masks for our clinicians, and when they are seeing some of our patients who may have a respiratory illness, they are inclined to use a much thicker mask. Familiarly, you might have heard of it as an N95 respirator mask, and that's really intended for the clinician to make sure that they don't receive or they don't have any aerosol that they breathe in. But for the most part, whether you're in an office space, whether you're in a classroom, whether you're outside but you're close to other people, wearing the mask is really about protecting other people from you. So it's really there to capture any respiratory droplets either from your nose or your mouth and prevent that from being spread either to other people or to surfaces. And so we encourage people wearing a mask really anytime they're going outside of their home or outside of their office or outside of their car, or they're in close contact within 6 feet of other people who may not be part of their household.
Thank you, Dr. Alexander. Thank you, Dr. Alexander. Dr. Salko, could you talk to us a little bit about if there's a certain kind of mask that we need to buy, so as parents are getting their kids ready to go back to school, or as they're getting them ready to go back to the office or wherever their place of employment is? Is there a certain recommendation or any type of advice that you can give us on maybe what your experience is with masks?
Sure. The most probably common mask is something that I'm wearing right now is considered to be a surgical mask. This is something that stops the spread of respiratory droplets from me. They're disposable. If I get it soiled or I have to take it off and use another one, they're probably the most common one you'll see out there. The second most is probably a cloth mask, and these are of many different designs. I wish I had one to full. Dr. Alexander's got a cool one on now. That will, show off your flair if you like matching it to your bow tie or whatever else that might be important. But wearing those cloth masks are nice because you can wash them at home and take care of them and clean them for your adventures the next day. Some people are wearing, I think the term is a gaiter or something like that. There's some cloth that just comes up as a face covering and it will stay on their face. That one might be a little bit more difficult to wear as it stays right pressed up against your face. So I think about kids going back to school wearing this, or even adults. There's a lot more on your face with that one. The more specialized masks in the hospital, the N95s and those things, for what people are generally going to be doing, going to the grocery store, going to school, being out at an event, those aren't necessary or necessarily required. In fact, they probably would not be a benefit. There are some N95s that they're a thicker material, so they filter more particles. There are ones with little vents on the side, and they wouldn't be recommended because while you are filtering the air coming in, you are expressing whatever is coming out of you without any filtration necessarily. So the idea of the mask, again, that Dr. Alexander mentioned, is to protect other people. So you want to stop your respiratory droplets. You want to stop that stuff from going anywhere, should you happen to be someone that is carrying the virus unknown. And that's where it really gets tricky with this, is that if we all participate in these guidelines and wash our hands and wear the mask at distance, we can see this virus drop incredibly. And we know that now because of the number of studies that have come out that show over and over that there is a benefit to that.
Thank you, Dr. Salko. Deb, one of the questions that came in was about where people wear their masks. So we know that the recommendations for when we go into a public space, but what about people's cars or when they're outside? Can you talk to us a little bit about that?
The idea, as you've heard both Dr. Alexander and Dr. Salko say, is to protect somebody else from what I have. If you're in your car by yourself, you don't have to have your mask on. If you're in your car with family members, people that live in your home with you, you don't have to have a mask on. If you're giving someone a ride that you don't know well, somebody you work with perhaps, somebody from your neighborhood, somebody from church, yes, then both of you should be wearing a mask because you're going to be much closer than 6 feet. If you're outside and not around anybody, I walk in the evenings and I see people walking down the sidewalk by themselves with a mask on, and I think it's now uncomfortable, particularly as humid as it's been. Unless you're as part of a large group that's walking that isn't necessarily related, when you're outside, you're probably going to be okay. You can probably maintain that distance, that nice 6-foot distance easier. And unless you're going to be close contact, you likely don't need your mask on outside.
Thank you, Deb. That makes a lot of sense. Dr. Salko, there's a number of parents that had sent questions in about what they can do to help prepare their children whenever they're going back to school. So we know there's still a lot of questions out there. So from your experience with people coming in the office and questions that you're hearing, is there anything that you can share with the audience about what they might be able to do with talking with their kids about getting them ready and prepared?
Sure. Not just speaking as a physician, but a father of 4 with kids in every different level, one getting ready for college, one in high school, and then a couple in grade school. It's different for each of those situations. So if you have questions about school, a lot of the school letters and superintendent letters have been coming out recently. Schools are setting up their plans. I encourage you to get in touch with your school. They usually are having video chat sessions or online things that you can do to hear what the guidelines are going to be for at the school. As a parent and as a physician in the office, having your kids experience the mask and training them in a way to use it and what it's for is very important. Practicing this, just like practicing something like fire safety, is important. You know, how do you get out of the house in time? When you're out of the house, we do check in the car. We're like, hey, you got your mask? And kids have to have their mask before we go. We don't necessarily know what situation we might be in, but you want to be prepared. The other thing that's going to be very, very important for parents as they get their kids ready for school is that the school will likely require some level of home screening. It may be a temperature, it may be checking for symptoms, a certain number of symptoms. We know with COVID infection, sometimes the symptoms are mild, sometimes they're more severe. But it will be important for parents to review with their kids before they go to school. Do you have a cough? Are you feeling short of breath? Are there any symptoms there that are problematic? Because we want to make sure that those kids can stay home and stay there until they're healthy enough to be in a public environment like school, okay? So training your kids, another thing that I thought was helpful was grading behavior. So if we're out on a practice run and I'm taking the boys somewhere, maybe to the grocery store, we'll wear our masks and do our thing, and I'll ask them to grade their behavior or perhaps someone else's behavior on how they think they did. So a lot of people can use this with your family, with your friends, and say, you know what, we went out and you get an A+ for mask wearing, or I saw you wash your hands before and after you ate, A+. I saw you do something to make sure there was a 6-foot spread because you didn't have the mask on. These are all high-graded behaviors. If someone does the mask thing, and I'll get closer to the screen where there's nobody, you might see this sometimes. So I'm doing pretty good. You're not really wearing the mask, so it's not effective there, but you can grade that and say, you know, we can do better. So maybe my boys might see somebody else like that in public and say, Dad, I think that person maybe had a C, you know, and how you talk to them about it. But being able to grade it in a way for your kids so they can feel properly prepared. The same goes for hand washing. If you want to use hand sanitizer, that's great. Make sure you're getting it all over everything. You want to wash your hands, have the kids sing a song. Happy Birthday is the common one, to make sure they are washing their hands. The frequency of hand washing is also important. I feel lucky, having gone through medical training, that you understand surgical technique and you touch a surface, and then you bring it to your face. You could have just brought something from a surface to your face or from somewhere else. So remembering your hands are tools. They don't belong in your nose. It'll be important that the younger kids understand that and that there's gentle reminders. If you see them at home and they're eating and touching their face or they're touching other things, you can gently start to train and remind them while they're at home that these behaviors are new and will be expected expected when they're in school to protect them and their friends. We definitely want kids back in the school setting. The American Academy of Pediatrics and many other bodies have said, listen, the social environment for kids has been lacking, and they really need it. They need that social development. They need that connection. They need these things. And if we can do it right as parents, and we can provide the right guidelines and precautions before our kids get there, it's more likely we're going to be able to sustain it through the school year and beyond.
Dr. Stockwell, thank you. That was great.
Sure.
Very helpful. Maybe when we start getting back to school and back to work, there's been questions about how do we know if what we have, if we have COVID-19 or if we have the flu, or what should we do? What are some options for people when they're just not sure what they should do?
That's a good question, because we don't know. You won't know until typically you get seen by a provider and you've had an assessment. So depending on if you're going to an urgent care or primary care, reaching out, letting them know what's going on, letting them know your symptoms, and depending on the location, they can decide the best plan of action. For urgent care, we do different point-of-care testing, so we could test for flu or strep at the time of visit to help rule out one thing or another. The provider also does an assessment, chest x-rays if we're worried about some sort of pneumonia, getting full vital signs and getting a history, so knowing where you've been, what you've been exposed to, what your other health conditions may be. It's hard for just anyone out there to know exactly what they have without seeing the other resources and getting some of those tests. So utilizing those resources, take advantage of it. Take advantage of your providers, call, ask questions, learn more things. Because that time of year, we're coming into the flu season, we're coming into the cold, and the symptoms are very similar to COVID, and it can be very scary. So utilize everything you have out there, ask questions, give back everything here, let them know all your symptoms, and get your screening, get your tests, your provider.
Great, thank you. Deb, people had some questions in regards to when they should not go to school or not go to work. So if they're kind of not sure if they're sick enough to stay home, or what are some guidelines there for people to make sure that they're being safe?
Now, that's a great question, because I think we're so wrapped up in COVID that we forget there are other still run-of-the-mill diseases. It's still summertime. We're still traveling. We're still doing those fun summer things. We're still out at the lake and all those fun places. There's still norovirus that's spread by people not washing hands well. Touch. People don't wash hands well. People don't pay attention. There's lots of people out, and we pick up something and we touch our eyes or our nose or our mouth, and we end up with nausea, vomiting, diarrhea. It doesn't matter if COVID was not even ever heard of. You should never go to work or school with nausea, vomiting, diarrhea. You should only return to work or school after you've been 24 hours symptom-free with nausea, vomiting, diarrhea with no medications to help that. Cough, fever, sore throat. Again, if you have a fever, a sore throat, probably shouldn't go to work and school anyway. And many of us have this great work ethic. I'll just power through and go to work. And that never was really okay, and probably less okay now. So any cough, fever, sore throat, if your symptoms are more than mild, you probably don't need to go to work or school. If your temperature's over 100, you shouldn't go to work or school anyway. Just kind of screen at home very well, and there's still other things out there, like Jamie's mentioned a couple of times. Maybe it's not COVID, is it strep, is it something else? So if you consider it mild, and that you would maybe work anyway with it in a pre-COVID world, that might be okay, but just ask yourself today, can I stay away from people? Can I wash hands well? Or can I just stay home and get well so that I go back to work tomorrow and I'm not spreading anything?
Thank you, Deb. So, Jamie, one of the questions was in regards to if people do need testing. So if we need a test, can we come to Maine Urgent Care?
Yes. So we do the COVID testing. It's just a swab that goes from the nares. We'll see a provider so they can help determine if there's any more other tests that you need done, and they can also give you some education on what to do while you're waiting. So while you wait for those test results, what should you be doing? Should you be quarantined? Should you be isolating? And then what do you do when you get those results for a negative or a positive? They give you some guidance on where to go with that and what to expect. If you have a positive, the CDC may be reaching out to you, looking at all the information. So definitely if you're concerned about it, or even if you're not, if you're traveling, or if we've had a lot of travelers come in lately because of coming into the state of Maine, you can't get into a hotel without having a negative test. So you may not have any symptoms, but every state is a little bit different. You may have questions, so helping to answer some of those questions, making sure that providers are giving that great education and keeping everyone else safe by knowing the guidelines.
Great, thank you. Deb, how about break rooms and cafeterias? There were a number of questions submitted in regards to can you still go into your break room at your work and eat with your coworkers?
No, that's a great question. As we worked with some of the businesses that we worked with, one of the things we had them do is mark off 6-foot spaces. Some workplaces have a nice large room like this, and that's fairly easy to do. Some don't. At our own hospital recently, we went into each break room, each area. We figured out how big it was, and then what the kind of potential maximum occupancy rate for that break room or cafeteria site was. And we've made those numbers known. So some places can only have 2 people in at a time. Some rooms may only be able to have 3 people in at a time. In my own office, our lunchroom is so small that we each eat in our own office now because we can't maintain a 6-foot distance. And when you're eating, you're going to have your masks down. So that's one of those times you really have to be extra vigilant around that 6-foot space. So you may have to conduct that kind of assessment in your workspace and say this room can only bear 2 people, and you may have to make alternate kinds of lunch. Luckily, we're in Maine and it's summertime, and perhaps you can go outside and sit at a picnic spot. But yes, you really need to pay attention to that.
There's a question that came in from Paul in regards to if you have underlying medical conditions like diabetes and asthma, what extra precautions can you take while out to be safe? Dr. Salko, could you talk with us a little bit about that?
Sure. There is reference to, I'll say, higher risk people on the CDC's website. They do categorize people into higher risk and then possibly conditions that may lead to elevated risk. And we counsel people through this at the office because if they have to negotiate work or public situations, how can they be best protected? Right now, there's not anything more that someone can do to be preventative except to be particularly cautious, more vigilant about your hand washing, more vigilant about wearing the mask, and being in an environment where you know other people are following the same guidelines. If it's a work situation, I think I would agree that you want everyone there participating the same way, and ensure that your employer has set up things that are keeping you safe. So sometimes people might ask me, I have a condition and I want to go back to work, or I'm nervous about going back to work. I always encourage them to contact their employer and say what things are in place so that I know that I'm doing the right thing and everybody else at work is doing the right thing. You may be sitting next to someone at work or 6 feet away in a lunchroom. You don't necessarily know what their conditions are. But knowing that you want everyone to follow the same set of rules can be comforting, and then you know you're in a safe environment. Things that are, the other thing I'll talk to people about with higher level or more at-risk conditions is what you're doing essential and necessary. And I'm not asking people to eliminate everything, but going out to a restaurant or being inside a smaller space for a longer period of time with more people obviously has more risk to it. And you might say to yourself, I have these conditions, I want to be sure I don't get it, I don't want to put myself in harm's way. When you go out for a drive in your car, you wear your seatbelt, okay? So there are safety things that you want to do and think about before you go somewhere. Being prepared, I think, is essential to this because it not only helps you do the right thing, but it should also help lower the anxiety of going to that situation, all right? So the example of it's more of a less of. So being outside, eating lunch outside is far better than eating inside because we know it's much less likely that you'll contact and be exposed to COVID or it be contagious in an outside environment. Sunshine helps. We don't have a lot of that inside, but sunshine helps if you're outside. There are these things that make it less risky or more risky. Thinking through some of those or contacting your provider to help you think through some of those will help you feel more secure in your outings. Okay, and I would challenge anyone to make sure they do this, because we don't want to eliminate these outings. We don't want to eliminate people being able to go to work or school or go out and have fun. But if we all do it in a safe way, we will then begin getting used to what are, call them new normals or call them a transition. We'll be getting used to different sets of behaviors that now protect us.
Dr. Sacco, how about gloves in the group?
That's a good question. We do get asked that a lot. I think everybody on the panel would be happy to raise their hand. No one's wearing gloves. Nor do you necessarily see that as a recommendation on the CDC's website or at any other places. So gloves, while they might feel protective, you know, we see surgeons go into surgery and they have gloves on, right? They do that. Before they do that, they wash their hands. Okay, so washing hands is really the key thing. Thinking of your hands as tools is important. So you're going to touch a door, all right? You're going to, grab something in the grocery store or wherever you are, you're in contact with things. These are tools. You don't want to necessarily touch your mouth or face or another mucous membrane to potentially contact that. So if you have a glove on and you touch something, you still have a surface contact, okay? So the glove doesn't necessarily stop a spread. It's just not going on your hand. It's now going on a glove. So that's something that I know people may feel more protected with. And I think if people do feel safer, I don't want to discourage you from not feeling safer, but I want you to think about what you're doing with or without the glove on. You still need to do the hand washing and be careful about touching things on your face or wherever you could spread something from a surface to your body.
Thank you. So there's been a number of questions that have come in, and this event was something that we brought to you so we could try to educate people and give you more information on our experiences. Dr. Sacco, are there other things that people can do with either their children or their family members that are scared, they haven't been out of the house and they're anxious and concerned? Are there things that we can do for them, or resources available that we might be able to tap into?
Sure. I think there's a lot of resources, and you'll find through the CDC site there are also some links, and we give patients links to mental health or how to talk about it at home. There may be good times to talk about it, but I would also encourage people to try to find some normalcy within their lives, things that they enjoy doing where there does not need to be as much of a worry or concern about COVID. If you're home, maybe watching hockey now, we're all glad to have some live sports on again. But if you're home doing that, enjoy that, okay? That doesn't necessarily need to take on a new conversation about COVID. So finding some time where you're living your life, where you're reading a book, where you're taking a walk outside, where you're not intensified on it. But it is good to regularly check in, okay, with family, with friends, with other people, so that you can gauge how you're feeling about it, what the new news is, how you can digest it, but then knowing that it is a good idea, definitely a good idea to put it down sometimes and just spend your time thinking about something else or, enjoying life in some other way. Especially in Maine outdoors now, you can get out there and get some fresh air. That also helps.
Thank you very much. That's great. Thank you very much. How about in regards to getting our kids ready for maybe online schooling, if that's the option that people are choosing? Is there anything that we can do with our kids to prepare them for that?
Sorry, did anybody else on the panel want to answer? No. I can, reflect that there are some people that are going to say, I am nervous about sending my child to school in a public place, and online schooling is an option for us. They, have the tools and equipment available. They will definitely reduce their risk of contacting and contracting COVID if they're at home. They're not going to be out in public. It may be more comfortable for them because then they don't have to necessarily wear a mask in a public setting. So as long as those tools are there, What we find that sometimes not there is the social setting, the environment interaction. So with kids especially, if you can find a way for them to still continue to maintain some social interaction, that's very important for them. Whether it's online or you can have friends over the house distant, that's something that will help children be a part of their peer group that is essential to their growth and development. Setting up a schedule at home. I read a nice article, I think it was about school in New York and other places where they're not going to allow kids to wear pajamas or lie in bed for online school. So having a space in your house, having a schedule set up of when and how they're going to accomplish things is important. It will help them keep pace with the work. It'll help them feel more comfortable and achieved, and there's a time that they'll do their work and then a time that they won't. We experience both ends of it, where children may feel overwhelmed because there's a lot of online assignments and they can't seem to shut the computer off or stop doing because more things keep coming. You'll also have kids that are very distracted and can't focus on one thing. But if you set up a time schedule, it's a little bit easier to have them function during that time for school and then afterwards. Things we tell all the parents and all the kids in preparedness for school, during summer, kids stay up later. They might not be getting as much sleep. We start to enter a routine as you get closer to school to get ready for school time. Waking up in the morning, having your breakfast, brushing your teeth, all those things are essential. Even if you're not going to be in front of someone, brushing your teeth is important, okay? Your parents will thank you, children, if you do brush your teeth. So if you're on an online thing, nobody's going to smell that, but you should brush them. So those kinds of routine things help kids adopt a better routine at home, and they'll be more successful and feel better when they're not working or when they are working. So, and that can work for adults too, for the work from home.
Great, thank you. So we are going to start to wrap for the evening. If there's anyone else that has a question, if you want to drop that in the chat box, this would be the time to do it. Panelists, do you have anything in addition that you wanted to add or talk with our audience about this evening?
I think it's important to remember to be kind to each other. Dr. Selko mentioned there are some people that will choose to school at home, some people that may not have the tools, the time, the wherewithal to do that, and they'll send their children to school. And I think if we just remember to be kind to each other, mask in public like we're supposed to, and just be a little nicer during these times.
Yeah, I really like that.
Thank you, Deb.
Yeah, I really like that. I would add too that I encourage people sometimes to seek out that little silver lining. For a lot of us, I'll say, especially myself with kids, we keep such a fast pace at what we do and have to do every day that the COVID pause, as I might refer to it, has given people a little bit of time to reflect and think about what they're doing and maybe not overwhelm themselves as the future starts to unwind. And also take some time, if you have it at home. People have done some excellent things like develop new hobbies. I'm pretty sure everybody baked bread during February, March, and April because I could find no yeast in the grocery store. So these hobbies and things that were created out of us having that time are also something to reflect back on and look and say, okay, that was cool. You might not have done it otherwise. So I think that's something that can help us maintain some positivity around the changes that we're all experiencing.
Thank you.
Great, thank you. So it's been a pleasure to share our experiences and insights with you this evening. I hope that you have learned something and that you feel better about navigating the new normal. I wish everyone a wonderful evening and stay safe.